Chapter 37 Mouth and Salivary Glands, Functional Anatomy of Mouth. Mouth is otherwise known as oral cavity or buccal cavity. It is formed by cheeks, lips, and palate. It encloses the teeth, tongue, and salivary glands. Mouth opens anteriorly to the exterior through lips and posteriorly through fauces into the pharynx. Digestive juice present in the mouth is saliva, which is secreted by the salivary glands. Functions of mouth. Primary function of mouth is eating, and it has few other important functions also. Functions of mouth include ingestion of food materials, chewing the food and mixing it with saliva, appreciation of taste of the food, transfer of food, bolus, to the esophagus by swallowing, role in speech, social functions such as smiling and other expressions. Salivary glands. In humans, the saliva is secreted by three pairs of major, larger, salivary glands and some minor, small, salivary glands. Major salivary glands. Major glands are parotid glands, submaxillary or submandibular glands, sublingual glands. Parotid glands. Parotid glands are the largest of all salivary glands, situated at the side of the face just below and in front of the ear. Each gland weighs about 20 to 30 g in adults. Secretions from these glands are emptied into the oral cavity by Stenson duct. This duct is about 35 mm to 40 mm long and opens inside the cheek against the upper second molar tooth, Fig 37.1. Submaxillary glands. Submaxillary glands or submandibular glands are located in submaxillary triangle, medial to mandible. Each gland weighs about 8 to 10 g. Saliva from these glands is emptied into the oral cavity by Wharton duct, which is about 40 mm long. The duct opens at the side of frenulum of tongue, by means of a small opening on the summit of papilla called caruncula sublingualis. Sublingual glands. Sublingual glands are the smallest salivary glands situated in the mucosa at the floor of the mouth. Each gland weighs about 2 to 3 g. Saliva from these glands is poured into 5 to 15 small ducts called ducts of Rivenus. These ducts open on small papillae beneath the tongue. One of the ducts is larger and it is called Bartholin duct, Table 37.1. It drains the anterior part of the gland and opens on caruncula sublingualis near the opening of submaxillary duct. Minor salivary glands. Lingual mucous glands. Lingual mucous glands are situated in posterior 1/3 of the tongue, behind circumvallate papillae and at the tip and margins of tongue. Lingual serous glands. Lingual serous glands are located near circumvallate papillae and filiform papillae. Buccal glands. Buccal glands or molar glands are present between the mucous membrane and buccinator muscle. 4 to 5 of these are larger and situated outside buccinator, around the terminal part of parotid duct. Labial glands. Labial glands are situated beneath the mucous membrane around the orifice of mouth. 5 palatal glands. Palatal glands are found beneath the mucous membrane of the soft palate. Classification of salivary glands. Salivary glands are classified into 3 types, based on the type of secretion. Cirrus glands. Cirrus glands are mainly made up of cirrus cells. These glands secrete thin and watery saliva. Parotid glands and lingual serous glands are the cirrus glands. Mucous glands. Mucous glands are mainly made up of mucus cells. These glands secrete thick, viscous saliva with high mucin content. Lingual mucous glands, buccal glands, and palatal glands belong to this type. Mixed glands. Mixed glands are made up of both serous and mucus cells. Submandibular, sublingual, and labial glands are the mixed glands. Structure and duct system of salivary glands. Salivary glands are formed by acini or alveoli. Each acinus is formed by a small group of cells which surround a central globular cavity. Central cavity of each acinus is continuous with the lumen of the duct. The fine duct draining each acinus is called intercalated duct. Many intercalated ducts join together to form intralobular duct. Few intralobular ducts join to form interlobular ducts, which unite to form the main duct of the gland, Fig 37.2. A gland with this type of structure and duct system is called racemose type. Racemose equals bunch of grapes. Properties and composition of saliva. Properties of saliva. Volume: 1000 ml to 1500 ml of saliva is secreted per day, and it is approximately about 1 ml/minute. Reaction: mixed saliva from all the glands is slightly acidic with pH of 6.35 to 6.85 specific gravity. It ranges between 1.002 and 1.012 tonicity. Saliva is hypotonic to plasma. Composition of saliva: mixed saliva contains 99.5% water and 0.5% solids. Composition of saliva is given in figure 37.3. Functions of saliva: saliva is a very essential digestive juice. Since it has many functions, its absence leads to many inconveniences. Preparation of food for swallowing: when food is taken into the mouth, it is moistened and dissolved by saliva. The mucous membrane of mouth is also moistened by saliva. It facilitates chewing. By the movement of tongue, the moistened and masticated food is rolled into a bolus. Mucin of saliva lubricates the bolus and facilitates swallowing. 2. Appreciation of taste. Taste is a chemical sensation. By its solvent action, saliva dissolve the solid food substances so that the dissolved substances can stimulate the taste buds. The stimulated taste buds recognize the taste. 3. Digestive function. Saliva has 3 digestive enzymes, namely salivary amylase, maltase and lingual lipase, table 37.1. Salivary amylase. Salivary amylase is a carbohydrate-digesting, amylolytic, enzyme. It acts on cooked or boiled starch and converts it into dextrin and maltose. Though starch digestion starts in the mouth, major part of it occurs in stomach because food stays only for a short time in the mouth. Optimum pH necessary for the activation of salivary amylase is 6. Salivary amylase cannot act on cellulose. Maltase is present only in traces in human saliva and it converts maltose into glucose. Lingual lipase. Lingual lipase is a lipid-digesting, lipolytic, enzyme. It is secreted from Cirrus glands situated on the posterior aspect of tongue. It digests milk fats, pre-emulsified fats. It hydrolyzes triglycerides into fatty acids and diacylglycerol, table 37.2. 4. Cleansing and protective functions. Due to the constant secretion of saliva, the mouth and teeth are rinsed and kept free of food debris, shed epithelial cells and foreign particles. In this way, saliva prevents bacterial growth by removing materials, which may serve as culture media for the bacterial growth. Enzyme lysozyme of saliva kills some bacteria such as Staphylococcus, Streptococcus, and Brucella. Proline-rich proteins present in saliva possess antimicrobial property and neutralize the toxic substances such as tannins. Tannins are present in many food substances including fruits. Lactoferrin of saliva also has antimicrobial property. Proline-rich proteins and lactoferrin protect the teeth by stimulating enamel formation. Immunoglobulin IgA in saliva also has antibacterial and antiviral actions. Mucin present in the saliva protects the mouth by lubricating the mucous membrane of mouth. Role in speech. By moistening and lubricating soft parts of mouth and lips, saliva helps in speech. If the mouth becomes dry, articulation and pronunciation becomes difficult. Excretory function. Many substances, both organic and inorganic, are excreted in saliva. It excretes substances like mercury, potassium iodide, lead, and thiocyanate. Saliva also excretes some viruses such as those causing rabies and mumps. In some pathological conditions, saliva excretes certain substances, which are not found in saliva under normal conditions. Example is glucose in diabetes mellitus. In certain conditions, some of the normal constituents of saliva are excreted in large quantities. For example, excess urea is excreted in saliva during nephritis and excess calcium is excreted during hyperparathyroidism. Regulation of body temperature in dogs and cattle. Excessive dripping of saliva during panting helps in the loss of heat and regulation of body temperature. However, in human beings, sweat glands play a major role in temperature regulation and saliva does not play any role in this function. Regulation of water balance. When the body water content decreases, salivary secretion also decreases. This causes dryness of the mouth and induces thirst. When water is taken, It quenches the thirst and restores the body water content. Regulation of salivary secretion. Salivary secretion is regulated only by nervous mechanism. Autonomic nervous system is involved in the regulation of salivary secretion. Nerve supply to salivary glands. Salivary glands are supplied by both parasympathetic and sympathetic divisions of autonomic nervous system. Parasympathetic fibers. Parasympathetic fibers to submandibular and sublingual glands. Parasympathetic preganglionic fibers to submandibular and sublingual glands arise from the superior salivary nucleus, situated in pons. After taking origin from this nucleus, the preganglionic fibers run through nervous intermedius of Risberg, geniculate ganglion, the motor fibers of facial nerve, chorda tympani branch of facial nerve and lingual branch of trigeminal nerve, and finally reach the submaxillary ganglion, Fig 37.4. Postganglionic fibers arising from this ganglion supply the submaxillary and sublingual glands. Parasympathetic fibers to parotid gland. Parasympathetic preganglionic fibers to parotid gland arise from inferior salivary nucleus situated in the upper part of medulla oblongata. From here, the fibers pass through the tympanic branch of glossopharyngeal nerve, tympanic plexus and lesser petrosal nerve and end in otic ganglion, Fig 37.5. Postganglionic fibers arise from this ganglion and supply the parotid gland by passing through auriculotemporal branch in mandibular division of trigeminal nerve. Function of parasympathetic fibers. Stimulation of parasympathetic fibers of salivary glands causes secretion of saliva with large quantity of water. It is because the parasympathetic fibers activate the acinar cells and dilate the blood vessels of salivary glands. However, the amount of organic constituents in saliva is less. The neurotransmitter is acetylcholine. Sympathetic fibers. Sympathetic preganglionic fibers to salivary glands arise from the lateral horns of first and second thoracic segments of spinal cord. The fibers leave the cord through the anterior nerve roots and end in superior cervical ganglion of the sympathetic chain. Postganglionic fibers arise from this ganglion and are distributed to the salivary glands along the nerve plexus, around the arteries supplying the glands. Function of sympathetic fibers. Stimulation of sympathetic fibers causes secretion of saliva, which is thick and rich in organic constituents such as mucus. It is because these fibers activate the acinar cells and cause vasoconstriction. The neurotransmitter is noradrenaline. Reflex regulation of salivary secretion. Salivary secretion is regulated by nervous mechanism through reflex action. Salivary reflexes are of two types: unconditioned reflex, conditioned reflex. Unconditioned reflex. Unconditioned reflex is the inborn reflex that is present since birth. It does not need any previous experience, Chapter 162. This reflex induces salivary secretion when any substance is placed in the mouth. It is due to the stimulation of nerve endings in the mucous membrane of the oral cavity. Conditioned reflex. Conditioned reflex is the one that is acquired by experience and it needs previous experience, Chapter 162. Presence of food in the mouth is not necessary to elicit this reflex. The stimuli for this reflex are the sight, smell, hearing, or thought of food. Effect of drugs and chemicals on salivary secretion. Substances which increase salivary secretion. Sympathomimetic drugs like adrenaline and ephedrine. Parasympathomimetic drugs like acetylcholine, pilocarpine, muscarine, and physostigmine. Histamine. Substances which decrease salivary secretion. Sympathetic depressants like ergotamine and dibenamine. Parasympathetic depressants like atropine and scopolamine. Anesthetics such as chloroform and ether stimulate the secretion of saliva. However, deep anesthesia decreases the secretion due to central inhibition. Applied physiology. Hyposalivation. Reduction in the secretion of saliva is called hyposalivation. It is of two types, namely temporary hyposalivation and permanent hyposalivation. Temporary hyposalivation occurs in emotional conditions like fear, fever, dehydration. Permanent hyposalivation occurs in sialolithiasis, obstruction of salivary duct, congenital absence or hypoplasia of salivary glands, Bell palsy, paralysis of facial nerve. Hypersalivation. Excess secretion of saliva is known as hypersalivation. Physiological condition when hypersalivation occurs is pregnancy. Hypersalivation in pathological conditions is called ptyalism, sialuria, sialism, or sialosis. Hypersalivation occurs in the following pathological conditions: decay of tooth or neoplasm, abnormal new growth or tumor, in mouth or tongue due to continuous irritation of nerve endings in the mouth. Disease of esophagus, stomach, and intestine. Neurological disorders such as cerebral palsy, mental retardation, cerebral stroke, and Parkinsonism. Some psychological and psychiatric conditions. Nausea and vomiting. Other disorders. In addition to hyposalivation and hypersalivation, salivary secretion is affected by other disorders also, which include xerostomia, drooling, chorda tympani syndrome, paralytic secretion of saliva, augmented secretion of saliva, mumps, Shogran Syndrome. Xerostomia means dry mouth. It is also called pasties or cotton mouth. It is due to hyposalivation or absence of salivary secretion, aptialism. Causes dehydration or renal failure. Shogran Syndrome, see below. Radiotherapy. Trauma to salivary gland or their ducts. Side effect of some drugs like antihistamines, antidepressants, monoamine oxidase inhibitors, antiparkinsonian drugs, and antimuscarinic drugs. Shock. After smoking marijuana, psychoactive compound from the plant cannabis. Xerostomia causes difficulties in mastication, swallowing, and speech. It also causes halitosis, bad breath, exhalation of unpleasant odors. Drooling. Uncontrolled flow of saliva outside the mouth is called drooling. It is often called ptyalism. Causes. Drooling occurs because of excess production of saliva, in association with inability to retain saliva within the mouth. Drooling occurs in the following conditions: during teeth eruption in children, upper respiratory tract infection or nasal allergies in children, difficulty in swallowing, tonsillitis, peritonsillar abscess. Chorda tympani syndrome. Chorda tympani syndrome is the condition characterized by sweating while eating. During trauma or surgical procedure, some of the parasympathetic nerve fibers to salivary glands may be severed. During the regeneration, some of these nerve fibers, which run along with chorda tympani branch of facial nerve, may deviate and join with the nerve fibers supplying sweat glands. When the food is placed in the mouth, salivary secretion is associated with sweat secretion. Paralytic secretion of saliva. When the parasympathetic nerve to salivary gland is cut in experimental animals, salivary secretion increases for first 3 weeks and later diminishes, finally it stops at about 6th week. The increased secretion of saliva after cutting the parasympathetic nerve fibers is called paralytic secretion. It is because of hyperactivity of sympathetic nerve fibers to salivary glands after cutting the parasympathetic fibers. These hyperactive sympathetic fibers release large amount of catecholamines, which induce paralytic secretion. Moreover, the acinar cells of the salivary glands become hypersensitive to catecholamines after denervation. The paralytic secretion does not occur after the sympathetic nerve fibers to salivary glands are cut. Augmented secretion of saliva. If the nerves supplying salivary glands are stimulated twice, the amount of saliva secreted by the second stimulus is more than the amount secreted by the first stimulus. It is because the first stimulus increases excitability of acinar cells, so that when the second stimulus is applied, the salivary secretion is augmented. Mumps. Mumps is the acute viral infection affecting the parotid glands. The virus causing this disease is paramyxovirus. It is common in children who are not immunized. It occurs in adults also. Features of mumps are puffiness of cheeks, due to swelling of parotid glands, fever, sore throat, and weakness. Mumps affects meninges, gonads, and pancreas also. Shogran Syndrome. Shogran Syndrome is an autoimmune disorder in which the immune cells destroy exocrine glands such as lacrimal glands and salivary glands. It is named after Henrik Shogran, who discovered it. Common symptoms of this syndrome are dryness of the mouth due to lack of saliva, xerostomia, persistent cough, and dryness of eyes. In some cases, it causes dryness of skin, nose, and vagina. In severe conditions, the organs like kidneys, lungs, liver, pancreas, thyroid, blood vessels, and brain are affected.